Hello, everyone. Welcome to the Skin Report. Today, we are going to talk about the top beauty, skincare, medical aesthetic treatment trends of 2025, which ones you should actually pay attention to because they are clinically backed. I'm Dr. Simran Sethi, an internal medicine board-certified doctor who also specializes in medical aesthetics and specifically focuses on skin of color. We're going to start with talking about skin barrier repair, then get into glass skin, Skin-tox or skin Botox, and no-tox or undetectable beauty, collagen banking, and then finally addressing loose skin, skin sagging, especially after weight loss. So let's get started. The first one, which is the skin barrier, is a very trending concept, and for a good reason. The skin barrier is what protects our skin from environmental damage from the outside, but it also protects the hydration and collagen inside our skin. Skin barrier is a very important concept in skin of color because a broken skin barrier leads to hyperpigmentation, which is a common issue in skin of color. Skin barrier repairing is a multi-step process. It cannot be achieved with just one skincare product or one skincare treatment. It is more of a skin cycling routine, and that involves using an exfoliant so that you have good penetration of skincare. Second, a retinol to stimulate collagen production to make that skin barrier. And then a antioxidant serum that is constantly protecting your skin from breakage of that skin barrier. But then finally, something to seal moisture in your skin, which is usually achieved with a high-dose hyaluronic acid serum. Now let's talk about glass skin. Glass skin is a term that refers to skin that looks hydrated, glossy, and basically without any pores. Now, of course, we all have skin pores. They're very, very important, but we're talking about minimizing pores and having a hydrated appearance to your skin. Glass skin is something that can be achieved with skincare, but remember, it cannot be achieved with Vaseline. That is a common misconception. A lot of people will try that, but that will not give you glass skin. That will just make your skin break out because it is so occluded and it is actually thirsty. So glass skin can be achieved with a nice combination of good exfoliation, hydration, and then sealing your moisture into your skin. And that is done with hyaluronic acid applied on top of your skincare. Glass skin can also be achieved with certain skin treatments, which are mostly in the Skin-tox category, which I'm going to talk about next. Skin-tox or skin Botox it has been around for a little while, but I think it has become a lot more popular in the last year. Now, remember, Botox, which is normally injected into the muscle, is going to cause muscles to not move so that you don't have a lot of deep lines and wrinkles on the skin above that muscle. But Skin-tox is not put into the muscle underneath our skin, so it doesn't cause any muscle paralysis. Skin-tox is delivered into the dermis of the skin. And over here, it will cause a reduction in the movement of a small, tiny muscle in the skin called erector pili that increases the size of our pores. So skin Botox can actually reduce the size of your pores and help you with the appearance of glass skin. It can be delivered with a direct injection into the dermis in tiny blebs all over the skin, or it can also be microneedled into your skin. Now let's talk about no-tox or undetectable beauty. There have been a lot of celebrities who've come out saying that they have dissolved their fillers and for a good reason, but it has also led people to believe that fillers are never to be used, always avoided, and are very dangerous for you. That is actually not true. When fillers are used incorrectly, they do need to be dissolved and they do stack on each other. So in my practice, I like to first address the entire face by addressing any kind of sagging in the skin and doing lifting, sagging reversal with collagen stimulation, with products like Sculptra to cause a lift in the skin. And then we go in and use fillers for small precision work, like enhancement of the lower face or lips, or improving a little bit of volume in the cheeks to prevent that detectable overfilled appearance. Next, let's talk about collagen banking. The concept of collagen banking refers to doing collagen-stimulating treatments using collagen-stimulating skincare products constantly throughout the year so that you can continue to build collagen and have stronger skin that is not only clearer, but also more resilient to fine lines and wrinkles and sagging. Collagen banking is something that involves using daily skincare that stimulates collagen. And that would include things like retinol, vitamin C, vitamin E, peptides. And when it comes to treatments, my recommendation is try to incorporate at least 2 to maybe even 4 treatments spread throughout the year if your budget allows it, that include things like resurfacing lasers, microneedling, adding enhancements to microneedling like plasma-rich platelets, exosomes, and you will definitely sufficiently build that collagen bank, making the skin less prone to fine lines, making it clearer, having smaller pores, and also making it tighter. Finally, let's talk about skin tightening treatments, especially for people who've lost a lot of weight. When people lose weight, they generally tend to lose volume in the face that was helping their skin stay lifted. And this volume is usually in the mid-face and the temples. When you lose volume in those areas, you start seeing sagging, which not only makes this mid-face area look a little sunken in, give it a more tight appearance, but it most importantly affects the jawline because all of this skin sagging goes down this way and causes the jawline to not look as prominent or sharp. And then the other area that's usually of great concern after weight loss is also the neck. The neck has fine or thin skin to start with, so when you lose a lot of weight, it starts sagging even more. You can also see skin sagging in different body parts, and there are treatments that are non-surgical for it. But remember, when it comes to skin sagging and laxity, there are times when surgery is a better option, and a doctor who is well-versed in medical aesthetics should be able to tell you that. My favorite treatments to address skin sagging include things like Sculptra to help restore a little bit of volume and naturally lift the skin. And we can do Sculptra not only in the face, but also in the body. The second is microneedling with radio frequency. Microneedling with radio frequency can address skin sagging. It also helps sharpen the jawline, but it also is a great solution for things like acne scars, fine lines, and deep wrinkles. We talked about a number of great trends for 2025 in medical aesthetics and skincare, and these are clinically backed, so you should be paying attention to them. The first one was skin barrier repair. Then we talked about glass skin, Skin-tox, the concept of no detox or undetectable beauty, collagen banking, and then we finished off with skin sagging, especially after weight loss. If there are any trends that I left out that you would like to ask about, please leave it in the comments. And remember, subscribe, turn on your notification bell so that you always know when we release new content.